Hello and welcome to my channel. The end of 2022 is finally here. Was it better than 2020 or 2021? I think so, but what does 2023 hold for us? I'm going to make 5 surefire predictions for this coming year. But before I get to my top 5 predictions, I want to list a few of the notable happenings in 2022. Number 1, the year of Omicron. Go back 1 year to early December of 2021, and the Delta variant was the main strain that was found. It's shown here in the color teal. Then skip just 1 month forward to January 2017, and Omicron BA1, here in tan, has circled the globe and pushed Delta out of the picture. BA2 in India, shown at the bottom in the maroon, by that time was outcompeting both Delta and BA1. But thankfully, according to reports out of India, the death rate was very low. In July, Omicron BA5 was predominant, but by November-December of this year, BQ1, shown in peach, had become the leader. Will Omicron stick around a bit longer? Experts say yes. Number 2, looking back. COVID in the U.S. became the pandemic of the vaccinated as COVID cases, hospitalizations, and deaths were greater in the vaxxed population than in those with natural immunity. Number 3, President Joe Biden announced the pandemic was over, and his handlers and the government health bureaucrats immediately said it was not.
Is the pandemic over?
The pandemic is over. We still have a problem with COVID. We're still doing a lot of work on it. But the pandemic is over.
Number 4, despite the constitutional ban on government impingement of free speech, the FBI, the White House, and others colluded with big tech and big media to suppress medical information that they deemed misinformation. Asking for a friend, they would like to know how can they get their misinformation put on the approved list of misinformation. Okay. On to my top 5 predictions for 2023. Number 1, this year could be the year the rest of the world finally figures out how to live with COVID. Yes, there will still be spikes of COVID in some areas, especially those that had a zero COVID policy and didn't allow natural immunity to provide widespread long-term protection. But COVID will be endemic in the U.S. population, and most people will have only mild cases, somewhere between that of a cold and the seasonal flu. Yes, people will still die from COVID, but not to the degree we saw before. Number 2, 365 days from now, we will still be under a federal pandemic decree, allowing those who benefit most to continue to profit. Big Pharma will still be raking in money from wealthy nations. Some countries will destroy out-of-date vaccines due to lack of interest, and poorer countries worldwide will still be left with their hands out. Number 3, natural immunity will be continually refreshed as the China virus circulates widely. Each new exposure to COVID will further boost an individual's immunity, which will mean that our population over time has considerable herd immunity. Evidence will continue to mount about the benefits of natural immunity to COVID. Many governments will continue the one-size-fits-all approach to vaccination, disillusioning more people. Number 4, hospitals will continue to complain about lack of beds. You'll see it in the news. It's what they do to get more funding. The dirty little secret is that, in general, the number of beds can be very fluid. I'll give them some free advice. Hire back the doctors and nurses and staff you ran off or fired when they chose not to be vaxxed. Number 5, those with natural immunity or those who say no to boosters will be criticized and demonized. On a serious note, I want to remind everyone that whether it is the flu, COVID, some other infection, or bioweapon, the best way to improve your survival the next time is to be as healthy as you can. You can take steps to support and strengthen your immune health. Here's a quick list. Number 1, eat a healthy diet rich in fruits, vegetables, and other nutrients. A diet that's high in nutrients and low in added sugars, unhealthy fats, and processed foods can help support your immune system. Second, consider supplements. Many people may benefit from taking immune-supporting supplements like vitamin C or vitamin D, zinc, quercetin, to name a few. Number 3, get enough sleep. Getting enough sleep is important for immune function. Most adults need 7 to 9 hours of sleep per night, so work that into your schedule. Number 4, exercise regularly. Regular physical activity can help support immune function and reduce the risk of certain infections. Number 5, avoid tobacco and excessive alcohol consumption. Both tobacco and excessive alcohol can weaken the immune system. Number 6, manage stress. Chronic stress has many negative impacts on your body, so it's important to find healthy ways to manage stress. And last, talk with a medical provider that you trust, your doctor, about what vaccines might be appropriate for you. That's all I have for now. Thank you for watching, and Happy New Year to everyone.